in 2021 as the Parliamentary Task Force on COVID-19. That was during the COVID pandemic, when we were assessing the readiness of Mbale City to handle some of these cases. And the same issues were raised, issue concerning ambulance, then issue of space, because the same ward is being shared by the male and female patients, which is not right, which is not proper. The same ward is was being used by women who are just delivered and those who are coming in. So it was not right, and we raised those issues. We noted them in the report. And one of the recommendations was to request the Minister of Health to upgrade this facility to a hospital. But unfortunately, because of land issue, I think that would not go ahead, and we advised to mobilize resources and purchase land, hand it over to Minister of Health to develop it. I interacted with the city leadership, by the city council, and they said they didn't have the resources as well to purchase land, and people around were not willing to donate land. So that was the issue concerning the expansion of Namatala Health Center. The issue of the ambulance, I think I raised it, and by then we were told Mbale as district. Okay, they consider it Mbale district. The health district is, they consider Mbale, Abududa, Manafa, and Mbale city and district. So they consider it as one district, and they say that appropriated 8 ambulances. Minister of Health told us that given us, but when we tried to find out, we only had information that we had received 2 ambulances, one which was stationed at Buduta Hospital and the other one at the Mbale Regional Referral Hospital. So we were wondering what happened to all the other ambulances. So they said they were, the ministry had recalled them, but they would provide them essentially. So up to now, we've not seen those ambulances. We're still demanding for them because it's quite a huge area, and most of the areas are hard to reach. So we need ambulances that can facilitate. But we were promised that they would provide them as soon as possible, which they have failed up to now. So hopefully, I think I'll raise it again with the ministry on the floor of Parliament, because we need those ambulances to help our people. Then on failing to do the surgeries and what they call them cesarean sections, it is because they don't have facilities to store blood. Because mothers that are going to deliver, usually through C-section, need blood. They need blood transfusion. So initially it was being done, but they would have to request for blood from elsewhere and wait for blood to be delivered, then they carry out the procedure. And then also the issue of the bed, because they had one bed which was in a poor state. So as a member of Parliament, I raised the similar concerns, and thanks to the media, the story sold out a lot, showing the status the hospital is in, because a hospital that has at least 10 mothers delivering every day. It's quite doing a lot. It's doing a lot. So because on average, I think when we analyze the past 1 year, they were delivering between 200 to maybe 300 babies per month. So this is quite a huge number, and we need those services around. So the ministry opted to close because they didn't have the resources to provide facilities to do blood transfusion or to store blood. But then this is a weakness of the Ministry of Health, because these refrigerators, I believe the government can afford them. Ministry of Health can provide these facilities that can store blood. People are willing to donate blood. We are donating a lot of blood. I think that's not the problem. The blood, yes, there are usually blood shortages, but that cannot be the reason as to why. So you end up finding that, according to the doctor, what she stated, that the mothers who are dying have kept on increasing over the past few months. And this is because they have to wait for long periods of time. Because now Mbale Regional Referral Hospital is catering for the entire sub-region, Bugisu, Bukedi, and people are coming from far, Iganga, Busoga, to come and receive services in Mbale Regional Referral Hospital. So I don't think it has the capacity to cater for all this. These referral hospitals were given a certain number of people they are supposed to cater for, less than 1 million people. It is supposed to serve less than 1 million people. But when you look right now, it is serving about 4 million people, which is 4 times the number, more than 4 times the number that was planned to be served. So this and much more are causing many of our mothers to lose their lives. So I believe if we can have another maybe district hospital or city hospital in Mbale that can serve our local community, and then the regional referral hospital can serve the entire region, I think this would do much good for us. Still, it has been a common problem, but it still goes back to the availability of the land to construct the houses. The houses, they don't have the land where they can construct the houses. So if the ministry perhaps or government could step in and provide land for extension of this hospital, or get land elsewhere and transfer the hospital, Namatala hospital, and put up new structures, proper planned structures, because a hospital or a health center sitting on a plot of 100 by 200, which actually is small for even a residential house sometimes. It's quite small for a hospital because you need a lot of space for parking, you need maternity wards, you need theaters, you need all this, which cannot be provided. So I think for the short term, if government perhaps could step in and provide accommodation, because there are people who have built houses nearby, rental houses. If they would provide a small budget to accommodate some of these staff who are working tirelessly day and night to help our people. But then when you look at the funds appropriated under PHC, they are very little. The hospital cannot afford to provide accommodation for the staff. So I think this is still up to the Ministry of Health to go back on the drawing board and recognize the importance and the work that this health center and the staff of this health center are doing, such that they provide them with accommodation and conducive working environment. Then you even find the shortage on small things, the PPEs. They fail to have gloves, they fail to have soap to clean the facility, which is quite alarming. I used to provide them with liquid soap to help with cleaning some time back whenever there was a shortage. But because of limited resources, I cannot continuously do it as an individual. So it becomes quite expensive for me as well. But this is work of the government. We need our doctors to serve us in a healthy environment. They need to put on gloves, they need masks, they need soap, and all this the ministry is still failing to provide. The road to the issue of roads, it has been a big concern, and especially for us with Gisu. Ever since we had the rains in August last year, many of our bridges were washed away, many of our roads were destroyed. But again, our hope was in government, and I wrote to the office of the Prime Minister. They promised to provide additional funds to come and cater for these bridges and roads that were destroyed in Mbale City, and that appropriated about 200 billion under emergency fund to cater for most of the bridges and infrastructure that had been destroyed in the disaster-prone areas. But unfortunately, we all don't know where all this money went, because in Mbale only one bridge was worked on, the Samaga Bridge, and they first did substandard work. We had to come out and complain and raise queries. That is when they came back and did some work. But when you go to areas of Mutoto, when you go to areas of Ufumbo, you will find very many of these bridges and infrastructure have been destroyed, and most of them are expensive structures. And when you look at the city right now, we are given very little money. Every quarter we are receiving 250 million under the road fund. So 250 million, it is not enough to cater for all the over 600 kilometers that we have in the central business district. So this money is very little, because if we are to do even just one bridge, a standard bridge alone can cost between 300 to 500 million shillings, a small bridge. So it means in a quarter we'll have to do one bridge and forego working on all the entire roads. But at least the money for the previous quarter and this quarter, we have a balance. We have planned, we are going to do maintenance on some of the works, and then we are going to do upgrading on other roads. So we've identified 3 roads which are in a poor state, and that one connecting Namatala from Loko to Namabasa is one of the key roads that we are looking at, and we are looking at working on the drainage, putting in proper culverts, and putting first-class maram on this road, at least for it to be quite good or in a good state for the next maybe 2 to 3 years. So it's one of the key roads we are going to work on. The other road we are looking at, which is in a poor state, connects from Kaga up to down in Marala. So this is also one key road that we are going to be working on. Then most of the other small roads we just expect to do maintenance, working, grading, and then spot patching where we think is in a very poor state. So it's going to be hard, but fortunately we've been given additional kilometers of USMID, the World Bank project. So this is going to help because USMID at least and the World Bank has been able to do quite significant work. When you look at Mbale City, most of the roads that are very good or in a very good state are under the USMID project. So they have added us some kilometers, and now we've looked at areas that are around town because USMID comes with certain conditions. You cannot take an USMID road in Gomboyi, you cannot take an USMID road in Bukonde. So it has to be around the city, it has to meet certain standards, it has to be able to carry certain traffic, it has to interlink and connect with the existing USMID roads. So when you look at the roads that meet these conditions, they are quite few and they are around the areas of Maluku. We are going to work on most of the lanes in Masaba Ward, that is Indian quarters, under USMID. Then we are connecting that road from around the Gwere market that connects back to Manafa where you were saying. So it's one of the roads that we expect to cover under the new 5 kilometers that USMID. From I think that church, Pure Heaven, it's called Pure Heaven? Pearl Heaven, yeah. Pearl Heaven in the Gwere market comes out around about in Likangilo. So those are some of the roads we are looking at under USMID, but still they take time. We expect it to begin probably July next year, in the next financial, because right now we are still in the design. They are designing the project and completing the already existing USMID 3 project. So at the end of this, we will expect to work on that. And the other road we have looked at is the Nauyo, the road in Nauyo that cuts Nauyo into 2. But the challenge is people have encroached the road reserve, and it has become a problem because it has to meet certain standards. We need a road which is quite wide with solar lights and walkway, and people have encroached on this land. So this is still a problem, but I will be engaging with my colleagues, the area leadership. We will be engaging the community and see if the community is willing to give way for development. In case they are not, then we'll look at other roads that people have not approved so much.